Hello, everyone. My name is Joshua Layng, and I'm here to talk to you about human speech. Speech is the most common form of interpersonal communication. Those who can speak extraordinarily well are said to have silver tongues. They can enunciate and throw their voices in such a way to make their thoughts clear as day. Unfortunately, not everybody has this gift. Of the human population, 5 to 10% of them speak normally, that is, without a speech ability or impediment. And that means that 90% to 95% have one or more speech disability. And in the United States, 8.3% of children ages 3 to 17 have speech disorders. In the United States, the school system offers speech therapy as a part of their education. And there's also speech therapy provided for adults with aphasia, which is a speech disorder brought on by any sort of head trauma, such as a stroke. But not all. One method of speech therapy is not one size fit all. Everyone has a different way of learning, and everyone has a different ability that needs to be catered to. There are phone and tablet applications that help with speech therapy that can be used in addition to or in lieu of a professional speech therapist. Of course, this means that there are some missing demographic because the United States provides it as a part of the school system. Homeschooled children ages 3 to 17 would not have access to the school speech therapist. The same goes for people who have graduated high school, as they would have no reason to use the school's speech therapist. And many of the mobile apps that exist have no way of catering to a specific speech disorder, which would mean a patient would have to sift through several irrelevant exercises in order to find one that suits them, one that actually helps them. Mary Lund is finding herself in such a situation. She is a new college freshman. Her major requires that she do a bunch of public speeches and presentations. Unfortunately, she has a rather awkward stammer that causes her speech and presentations to be prolonged past the allotted time due to the stammer and stuttering disrupting her flow of speech. And adults with speech disabilities also face other issues, such as bullying. A bully can easily pick up on a speech disorder and mock and humiliate them for it relentlessly. And psychologists at Leeds University and Goldsmiths College in London, England, found that out of 276 adults who stammer, 83% were bullied at school, and 71% of stammerers face abuse at least once a week. And that's outside of school. Carson Williams is finding himself in such a situation. He is a white collar office worker in a cubicle office, and while his speech disorder is word final repetition, which is when somebody repeats the final word or syllable of whatever they just said. And it usually doesn't cause him any troubles, but a couple of his coworkers have started mocking him relentlessly for it. This is causing him great distress and is making him dread coming into work. So this is greatly affecting his mental health, and likely many others across the nation like him. This is where my app Sylla comes in. Sylla is a speech therapy app for postgraduate adults. It uses patient-specific exercises tailored to their specific needs. This is done by entering their what speech disabilities they have into their personal profile on the app, which is contained entirely within the device, and so it is entirely local, so there is no need for internet connection or to sign up for anything. And there will also be graphs and exercise history to show how a patient is progressing that they can show anyone else, such as a loved one or a professional speech therapist if they are using Sylla in addition to the therapy. How Sylla works is that it will use voice recognition to pick up on the different nuances of a speech disorder. For example, in this prototype, we have a swallowing disorder being exercised for, which would cause a break in speech, sometimes in the middle of syllables, such as "can," "an," as shown here. Their text is red, indicating that they failed the exercise. If they succeeded, the text would be green. There will also be mouth charts to help those who have pronunciation difficulties understand how the mouth works depending on what they're saying. This is often used for singing and choral exercises, so it would translate well within general everyday speech. As for advertising, Sylla will be advertised in the ad space of websites on desktop and on mobile, as shown at the bottom of the phone screen here. And it will also be shown in the ad space on other mobile apps. These are all my resources for my research on speech disorders, speech therapy for adults, and bullying of children and adults based on speech disorders and otherwise. Thank you.